Welcome to I Matters with Dr. Eldrick Ekanem.
Hello everyone, welcome back to my channel. I'm Dr. Eldrick Ekanem, and in today's video I'm going to be talking about a condition in the eye known as myopia. What is myopia? Myopia is actually a refractive condition in the eye, also known as short-sightedness. It happens that whenever you are always seeing things at far, it gets blurred, and when you are looking at things at near, it gets clearer. That's actually what a myopia is all about. What are the signs and symptoms of myopia? How does it start? First of all, it can be hereditary. You can inherit from your parents. If any of your parents are always wearing glasses, find out the type of glasses that they are wearing. Then two, when you start having unnecessary headaches, and it always starts from the eye to the head. You have to go and meet your healthcare provider, your eye care provider, so that you can test one for glasses to be sure it's not a refractive error that's actually the issue. For myopia, it might also be that you have myopia, that you're having that pain that is getting from the eye to the head. The other symptom too might be eye strain. For a short-sighted person, when you strain your eyes too much to see things at far, it makes it so difficult for you that your eyes start having pains and all that, and from there it links to the head. It links to your head. You start having headaches from the eye strain. That's another symptom that you're having what we call myopia. Most especially when you look at things at far. Okay, so I have a schematic eye before me today in which I want to use to demonstrate and explain how myopia occurs in the eye. Okay, so now this is the front of the eye. Okay, this is the front, this is the side. These are the extraocular muscles of the eye, the sheets where the eye can be elevated, depressed, and go and move from left to right. But that will be for another day. And this is how the inside side view looks like. Okay, this is the cornea, the brown part. This is the cornea. I'm going to remove it. This other brown part that you are seeing here is the iris. Then we have this open space in between the iris, which is called the pupil. Okay, and then after this, we have another layer. Okay, behind it. Let me bring it out so you can see. We have another layer here, and it's the lens. Okay, it's actually the lens that was behind this. Now, what's the work of this lens? This lens elongates and comes back to a normal position just to assist the eyes to be able to see things when it looks down and when it looks up. That's the work of the lens. It stretches and returns back. Okay, so I put back the lens and the cornea. Now, behind the lens here, you have this other open part. Okay, this open part now is the posterior part of the eye. Okay, and these are the vessels at the back of the eye, and you also have the vessels, you have the nerves too at the back of the eye. Now, the nerves are somewhere close here to this point, in which when light rays falls into the eye, for a normal eye now, when light rays enters this eye through you trying to look at an image, it comes in here as light rays, because the whole of this open space here is filled with a jelly-like substance called the vitreous humor. Also here in front here, it's also filled with another fluid called the aqueous humor. Okay, now for a normal eye, this is the normal shape of the normal eye. When you look towards something like an image, like an object, it has to fall on this retina and the nerve fibers will now send signals to the brain to interpret it as an image of an object. Now, when you look at an object, it transmits through this transparent medium, the cornea, through the pupil to the transparent lens, through it will already pass through from the cornea to pass through the aqueous humor, transparent fluid. It will now go to the transparent lens, then to now enter the transparent vitreous humor, the gel that is here, the jelly-like substance that is here, before it falls here on the optic disc, on the retina. Now, For a normal eye, when that light rays is coming in, that's how it will be passing till it falls in, so that the nerves can send signals to the brain to interpret that this particular object is an image of this. I mean, this is an image of this particular object. Okay. But for a short-sighted person, for a myopic eyeball, this eyeball is not this normal shape that you are seeing here. It's going to be elongated, okay, a bit bigger than the normal shape. Now, when light same phenomenon, when light rays is passing through, it's meant to fall on the retina on a normal eye. But for a myopic eye, it falls before the retina. And when this happens, the light rays can't fall here so that the nerve fibers send signals to the brain. So what happens? It stays here and everything will looking blurry. You can't detect what it is that you are seeing. So what happens? You need you have to once you notice that that's actually a sign or a symptom that you're actually, having a refractive condition. Once you notice that, you need to rush to go and see your healthcare provider. Rush and go and see your eye care provider. Okay, so when you get there, they will now test run you for glasses. Then, since the light rays was falling before the retina, it means you have myopia. And certainly, when they are test running the whole stuff, you are going to be going towards tending towards minus lenses, okay, because you're actually a myopic patient. What does minus lens do? Minus lenses are concave lenses in which they try to push the light rays. It will continue to extend the light rays. That's what minus lenses do. When you put a minus lens in front of a light source, it continues to elongate the light source to make it longer. Okay. So same phenomenon applies to the eye, assuming this is a minus lens, and then you put it in front of the cornea, okay, through your trial frame or your spectacle or anything you're wearing to hold the lens in place. What happens? It will push the light rays from where it was here to put it on top of the retina. It must fall on the retina. So when we are putting a minus lens, it has a degree. Okay, so a degree to the point where you see very well and you're comfortable, you're not having headaches. Your eye is not, you're not feeling any pulling sensation with the minus lens. It means the minus lenses is actually the accurate is actually the accurate degree that you actually need. That particular one is the actual degree that you actually need for that condition. So when you wear the minus lens, it pushes the rays to the retina. Okay, so when it gets to the retina, that's when you now start interpreting, okay, this is a book, this is a pen, this is a chair. So that's what happens. So now, when it gets to children, okay, when it gets to little children that can't talk, you know, how do you determine how because most times you need to start like children from your child need to try to make like to know whether any of your children have any eye issue and it has to be corrected on time because any eye issue by the age of 1 to 11 years can be corrected but immediately after 11 years it can't be corrected anymore. Okay, so you have to continue to wear glasses for a very 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 long time. Okay, so now how would you know that your child actually have this eye issue, this myopia that we're talking about, so that you can take her or him to an eye care provider to be able to handle that condition on time now that he or she is still very young. Okay, first of all, when you notice that your child is always very close to the TV, every time he's always watching TV and the distance, like the range in between which he's sitting down and the TV screen, it's very close. Once you start noticing that, then your mind should take you to, oh, this child will be having refractive error called myopia. Okay, another symptom, the second one is when you start seeing that your child is actually rubbing the eyes too. Frequent rubbing of the eyes also means that that child might be myopia. Another sign that you might notice that this child has myopia is when the child start blinking excessively, like trying to narrow the blinks too much, then try to narrow his or her eyes, the lids to make sure that he's seeing things clearly. And even when he opens the eye wide, he can't really see it. But when he squeezes, the eye, try to narrow the eyes to look at things, then that's when he can see clearly. It means that child has myopia. Another sign again in which you can notice from a child that has myopia is that most times the child, someone might wave at the child from a distance. The child might not even notice it that somebody even waved, and he or she might pass. You think maybe he's being stubborn or so, he start beating up the child. No, that's not how it works. So you have to find out why. Is he actually really seeing that person, waving at him or her? Then that is where the problem comes in. That child might be short-sighted. So it's better you take the child immediately notice all these symptoms and signs. And to just take the child immediately to an eye care professional to be able to handle that issue on time, so they can be corrected at the age of before the age of 11 years. Okay. Then for adults, for big people like us, when you start seeing all these signs and symptoms, like, okay, I'm not seeing things very well at far, I'm now seeing very clear at near what's going on, most times you lower your eyelids, you try to see things to be clear, but still you are straining your eyes, you start having eye strain, you start having headaches, this headache that comes from the eye to the head, okay? Then you start feeling, somehow, immediately you notice all this, you need to rush to the eye clinic for a proper checkup of your eyes. Now, when you get there, for some of us that already know that we have short sightedness, that we are wearing glasses, and for the new upcoming ones that are still, trying to notice the signs of it, probably you have it, but I don't know what it was already. Okay, it's high time you go and meet your healthcare professional, your eye care provider. Okay, so when you get there, what happens? You run a test on your eyes. Probably you have been diagnosed of myopia and all that. Okay, so after that, what next? You need to start wearing your glasses. Don't keep the glasses away because you don't want to. I've had patients that don't want to know anything, that don't want to hear anything about glasses. They don't even want to even wear it. I just don't know what the problem is, but they don't just want to wear it. Some of them will telling you in their family nobody bought the glasses, so they want to wear it, and God forbid they cannot be wearing glasses, and all. When it comes to your eyes, you need to take care of your eyes. The eye is the window to the whole body. You need your eyes. Anything you have to do to make sure that you are seeing clearly with your eyes, you need to do it. Yes, the eye is very, very, it's the most sensitive part in the body. So most of the patients are always like they don't want to wear glasses, they don't want to. You have to wear your glasses. Now let me tell you the complication that comes with you not wearing your glasses. One, if you're not wearing your glasses, what happens? It will progress. For example, now you were being diagnosed of myopia of minus 050, let's say, or minus one, and that was even like, how will I put it? That was even small, and you were supposed to wear this, in which with this particular power of the lens, it's going to sustain, like it's going to like keep that sight that way without making it to progress. But what you did was that you refuse to wear the glasses. So what happens? It progresses. It was minus one before. You let for like 5 to 6 years. You didn't want to wear glasses. You were just straining. You were using your eye, like straining the eye to see things. And when you got back, when it now got worse, you now went back to test again for glasses, and then you noticed that you are at the point of minus five. Minus 5.00. When which is supposed to be minus one before, when you went back and you went minus five. And if you don't wear it at that minus five, you run away again. I don't want to wear glasses. Then no eye drop. There is no eye drop to cure myopia. There's no eye drop. The only solution to all this, I'm coming to that. I'll tell you guys the way that myopia can be managed. Okay, so if you leave it at that stage, that minus five, certainly it will lead to, it's going to lead you to minus 10 again. So it's better at that minus one, you're being diagnosed of myopia, you wear your minus one glass comfortably, wear it as in properly, always be on your glasses. Anytime you go back, but make sure that you have it at the back of your mind that every 1 to 2 years you're always going back for a recheck, just in case it step up a little bit or it comes down. You have to change your glasses to work alongside with your eyes. Now, what are the management of this myopia? Like, what's the solution to curing this myopia? Actually, myopia is a refractive condition. We have three things that can aid in managing this myopic condition. First is your lenses. You have to wear your lenses to keep that sight down way for you so that you don't progress. Second is by the use of contact lenses. If you don't want to wear frames, you can resort into wearing contact lenses. Of course, you can just put the contact lens and off you go. You are seeing with your prescription in that contact lenses instead of wearing the frame type. You can use the contact lenses with your prescription in it as long as you wear your glasses and it's helping you to see properly. You're not straining that eye. That's the best. Well, the third is surgery. Is an eye surgery in which that's for the ophthalmology part. The ophthalmologists they know how to handle that surgery and do the whole stuff. But those are the three key things. So if you know that you're not ready for surgery, you cannot go and do surgery. Then why not wear your glasses and your contact lenses? Anyone you choose. If you don't want to wear frames, if you don't want to go for surgery, then resort into contact lenses. Or make sure you wear your prescription to be able to prevent further progression of that condition. Okay. All right. So at this point, I'm going to say I'm going to wrap up this video. Thank you so much for watching. Thank you so much for the attention. Thank you for the whole likes, the thumbs up, the subscriptions. Thank you so much. And if you are new to my channel, hi, you're highly welcome. Just stick around and do sticking around. Press that subscribe button. Continue to thumbs up this video for more notification. Continue to watch and get the best information for your eyes. Please and please take very good care of your eyes. The eye is the window to the whole body. The eye is the way to the body. Alright, take care and have a lovely day. Bye.
Thanks so much for watching. Hope you learned from this video. Please like, share, and subscribe with the little bell for more notifications.